In this video, we are going to talk about HIV and how and when we code it, etc. All right, so the first thing you need to remember is you only code HIV when it is confirmed. Now, that is entirely different from what our guidelines say. Our general guidelines say if a physician says that something is rule out, suspected, possible, etc., that we code it as if it's confirmed. However, when it comes to HIV, if the physician writes suspected, possible, anything like that, HIV, we do not code it. It is only coded when it is confirmed. Okay? We treat HIV with HAART, which is the highly active antiretroviral therapy, and that's usually in the form of what we term, layman's terms, we call it an AIDS or HIV cocktail. A lot of different pills that they take. Once a person has developed AIDS, you are always going to assign B20 if the patient is admitted with an AIDS-defining illness or an HIV-related condition. All right, so let's say a patient is admitted with a broken leg and they have HIV or AIDS, and it is confirmed. That is not going to be our principal diagnosis. The fractured leg will be the principal. HIV or AIDS or the B20 code will be a secondary code. However, let's say you have a patient who is admitted with Kaposi's sarcoma and they are confirmed HIV. Your principal diagnosis will be B20, the AIDS or HIV. Okay? Patients may have a situation, you may come across a situation where you have a patient who is testing positive for HIV, but they show absolutely no signs, they have no symptoms, they're completely healthy. In that case, you would put a code of a status code of Z21 on that patient's record. If you have a patient's test come back as inconclusive, which does happen, then the code R75 would be the code that you put on. But because it is inconclusive and you can't say yes it's AIDS or no it's not AIDS, you cannot put that B20 code on. You only put that B20 code on if you have an AIDS-defining condition or illness, or if the patient does have a confirmed case of AIDS or HIV. So when we're talking about AIDS-defining conditions, this is the list. There's an excellent list. This is in your book. This is on page 200. If you come in with any one of these diseases, any one of these disease processes, they are considered an AIDS-defining illness. If you have an AIDS-defining illness, then you automatically code B20, which is the HIV/AIDS, because most typically you won't have any of this unless you are HIV or AIDS, HIV positive or have AIDS. All right. I wouldn't say memorize these, but I would very much familiarize myself with it. Maybe make note of it somewhere. Some of these are going to be pretty common. You know, you'll see cervical cancer. You'll need to know whether invasive or not, because only invasive cervical cancer is an AIDS-defining illness. Encephalopathy, herpes simplex. Now, just because somebody has herpes doesn't mean that it's an AIDS-defining illness. But if it's a chronic ulcer that lasts longer than 1 month, then it's considered an AIDS-defining condition or illness. So a 1 month or longer ulcer, you know, then you need to start putting that B20 code on. Mycobacterium tuberculosis, certain types of lymphomas, burkitt's, immunoblastic, primary of the brain. You need to be aware of what some of these things are, okay? If you have a woman who has AIDS and she is pregnant, then you're going to code 098.7 along with B20. All right, so you still have to put B20 on there, okay? But you've got to put that 098.7 on there as well. And where is that? I don't have my book with me, so I can't look that up. I don't have my book right now, so I can't give you the definition, the descriptor for that. But it would be in your coding book if you look it up. When you have encounters for HIV, okay, there will be testing to determine the status. Okay, so if you have an encounter, a patient's coming in to see if they have HIV, if they're HIV positive, you're going to put Z11.4 on there, which is screening for another viral disease. If you have counseling for an HIV negative patient, so you have a patient who comes in, did the screening previously, and came back in to get the results, and they're negative, most of the time those people are, you want to counsel them on high-risk behaviors. So when that happens, you're going to code Z71.7. Now they need to be, the key word is negative. They have to be negative in order to use that Z71.7 code. All right. HIV positive patient who's asymptomatic, that's going to be Z21. That is, you could also put a counseling code on there as well. And encountering an encounter for an HIV positive patient who is symptomatic, then you're going to move to your B20. Okay? So there we have HIV kind of in a nutshell. If you have any other questions, please feel free to post them on the forum, and we'll see what we can do. All right.